Good morning, good afternoon, good evening, everyone joining this webinar on whole schools approaches to mental health. My name is Peter Molyneux. I am the England lead for the Global Leadership Exchange. I use he, him pronouns. Whole school approaches to mental health have been introduced in England since 2018, and the government's committed itself to achieving 100% of schools and colleges working with mental health support teams. And so it feels like a timely moment to look to see how other systems are developing whole schools approaches and provide leaders in schools and those responsible for the design and delivery of mental health services to hear experiences of colleagues from overseas. And that's particularly to share experience of how they've implemented a whole schools approach to mental health, what their learning is, and what the key watch-outs are as people are developing this approach. And I'm absolutely delighted to welcome here today colleagues from California, Hilva Chan, Education Programs Consultant, School Health and Safety Office at the California Department of Education. Sara Geierstanger, Evaluator, School Health Evaluation and Research at the Institute for Health Policy Studies at the University of California, San Francisco. Jack Bareilles, Grants and Evaluation Administrator at the Northern Humboldt Union High School District, and Heather Nemour, Co-ordinator, Student Wellness and School Culture Department, Student Services and Programs Division, San Diego County Office of Education. You are all most welcome, and thank you so much for spending time with us today to share your experience. Hilva, I'm going to ask you to start, and if I may.
Yes, thank you so much, Peter. Thanks for having us here. So I think we can go to the next slide. We are with Project Cowell, and we are very excited to really share with you about how we implemented whole school approach to mental health with our colleagues here in England. So here's a quick agenda. So I'm going to give you a quick project overview, turn it over to Sara to talk about project evaluation. She's going to share about, some of the data we have collected and the tools we use. And then you'll hear from Jack and Heather on how they implemented whole school approach to mental health locally in the district and in the county. And I'll close by sharing a few resources that you might find helpful. So the next slide will show you that we're actually funded by a federal agency in the United States called SAMHSA, Substance Abuse and Mental Health Services Administration, under Project AWARE, which is the Advancing Wellness and Resilience in Education. Now, this funding came because of a school tragedy, a school shooting back in 2012 in Sandy Hook Elementary School, which started the Now is the Time initiative to provide schools and districts and states with resources to address school violence and to increase mental health awareness. So the overall goal is to develop a sustainable infrastructure for school-based mental health services, which allow us to really leverage resources and partnerships to implement mental health-related promotion, awareness, prevention, and intervention to improve youth access to appropriate and effective behavioral health services. So the next slide, you'll see our map. So we first started in the green area in Southern California back in 2014. We work with 5 school districts, including Heather's county, San Diego County Office of Education. And then in cohort 2, we actually move up to Northern California, working with 8 districts, including Jack's Northern Humboldt Union High School District. And we're currently working with our partners, 7 districts in Northern California in 2 counties to work with them to address mental health awareness, prevention, and access to care. And then on our next slide, you'll see our general model, which really guides our work in Project Caldwell. So component one is on addressing school climate, where schools implemented school-wide interventions to create a positive school climate where students feel safe and supportive to hopefully reduce the need for mental health services. And then component two is trying to increase access to school-based mental health services. And component three is about community collaborations, where schools work with community-based agencies to develop a referral pathway to identify, refer, and track students who will be receiving mental health services in the community. So a little bit more details about each component. Now, component one is regarding providing universal supports to create positive school climate, to really help students increase resiliency. So some of the examples include developing mental health policies, such as on suicide prevention or referral pathways to support practices. And we do want to focus on school-wide evidence-based practices that are proven to improve school climate, right? But we can reach 70% of our students. There's some examples that we've seen implemented by our partners, including positive behavioral interventions and support, PBIS, which is a multi-tier systems of support, social emotional learning, restorative practices, or mindfulness practices. Other districts also rolled out mental health awareness trainings, such as using youth mental health first aid, teen mental health first aid, or other mental health awareness and one-on-one trainings so students, families, and staff know how to recognize warning signs and to refer students for support. We also work to implement student-led mental health club on campus, where students are being trained to be leaders and advocates to increase mental health awareness on campus and to implement various wellness activities to improve school climate. So some examples including rolling out mental health resource fairs, implementing like kindness weeks, or doing like lunchtime yoga or mindfulness practices or other sound bath or other activities. Now, component one also includes, implementing universal screenings where all students get screened by a screener a couple of times a year to identify students for additional follow-up services. And the next slide is on components two, which is trying to increase access to care, such as bringing in college students, college interns, or hiring additional counselors or clinicians, right? So in the past, some of our districts found that hiring clinicians or counselors and bringing them in-house works really well, because then these staff can be also integrated into supporting school-wide programs instead of just providing counseling separately in a cubicle. Others, depending on the local capacity, feels like working with a contracted agency to get some support would work because there's a limited supply of clinicians in the region. Some would even want to grow their own clinicians by partnering with local colleges to train additional mental health professions. And I think Jack will speak more on this area as well. And then the final component is about community collaborations, where schools develop MOU or data sharing agreements to refer and track students for community services. This is where referral pathways is being developed to guide how students move through the system to ensure that they don't get lost and to improve access to appropriate care. So with that, I'm going to turn it over to Sara.
Great. Thank you, Hilva. So our team at UCSF has been conducting the evaluation of Project Caldwell for the past 3 cohorts. And I just wanted to give you this broad overview first of our approach. We evaluate a lot of school-based behavioral health programs throughout California. And the approach we are using is first collecting progress data. As a grantee of a federal agency, there's quite a bit of reporting that's required so that they can measure the impact nationwide. So we have developed systems for tracking the data about what is actually provided. We also are interested in collecting outcome data to document the impact of these services, and then very focused on creating infographics, research briefs, presentations, et cetera, to disseminate the lessons learned. And there'll be more resources at the end of the presentation, but I just wanted to highlight this website here, which we developed specifically for all of the documents we've created for Project Caldwell. If you go to this website, you can see, going back quite a few years, different documents we've created summarizing our findings. So this is the logic model for as evaluators. This is something we always start with when conducting an evaluation. You'll see here the activities column mirrors what Hilva just went through when we talked about the three main components of Project CalWell. Activities to improve school climate, activities to improve school-based mental health services, and then third, the community partnerships. And then for each of these areas of activity, we have process indicators. And these are actually required by SAMHSA for us to document on a quarterly basis. And then we have the survey outcomes. We have more outcomes, but these are the ones that we're focusing on today in this presentation about what school staff are reporting in terms of their increased capacity to support students, availability of services, reduced barriers, and then similarly looking at what the students are reporting in terms of their perception of reduced barriers to services, improved mental health indicators, and improved resiliency and school connectedness. So the first data collection system I wanted to mention to you is this grantee work plan and progress report. As I mentioned, the federal government requires us to document indicators. And so we've created this. We're now using Google Sheets for it. It doubles as both a work plan for grantees to describe what their plans are for the year, as well as their goals. And then it also tracks the indicators that are required. So we, as an evaluator, we summarize this data and report it to SAMHSA. And then one of my favorite parts of this job is semi-annual meetings with the grantees, Hilva, the California Department of Education, and our team at UCSF to review the data, talk about it, think about what activities went well and what could improve in the future, et cetera. And those are really productive meetings that we hold twice a year. So here's data that we collected, process data that we collected from cohort 2. So this is the JAX cohort. This was 2019 to 2024. As you can see here, we did a very detailed job of tracking how many individuals were trained in mental health prevention and promotion, and these were primarily school staff members, as well as community members, but primarily school staff members. And then we're also very interested in tracking workforce development. That is, how about training for people who are already mental health professionals and improving their own skill set? And there are also many people trained in that group. We also track referrals made, and then very interested in how many of those referrals actually result in a service being received. And then for the third component is that partnerships, the number of community partnerships that are created through this grant. This is a bit of a tangent, but I wanted to mention to you that one of the most popular trainings that was conducted in cohort 2 is called Youth Mental Health First Aid. You might have heard about this. This is a curriculum that was actually developed in Australia and is now used throughout the country, very popular here in California. And through cohort 1 and 2 of Project CalWell, we actually surveyed individuals a month after the training to see how it impacted their confidence. So you can see here huge increases in confidence among participants in their ability to recognize when a youth's behavior is a sign of emotional distress, listening non-judgmentally, giving reassurance, encouraging them to seek professional help, and knowing where to refer youth for mental health supports. It's a kind of a long training. It's 6 to 8 hours. So there's some downsides to the training in terms of logistics of finding staff time to attend. But again, this is a proven effective strategy. There's been lots of papers published on the effectiveness of this training. Another tool we use is the California School Staff Survey. So in California, we're very lucky to have this system of surveys sponsored by the California Department of Education in collaboration with West Ed. And the School Staff Survey has a core module, and then we've also created a student wellness module, which asks school staff their perceptions of students' social and emotional wellness, mental behavioral health needs, as well as their perceptions of the availability of supports. So you can actually download the surveys right here, and there are public reports available online as well. I'm just going to share with you some results from, this is cohort 2 of Project CalWell. And you can see here from 2020-21, which is the blue bar, to 22-23, which is the green bar, there were huge improvements in the percentage of school staff who are reporting that students are afraid of what people might think if they seek help. So there's a large reduction from 63% to 44%. Also, we are very excited to see this from 49% reporting that students did not know where to go for help to only 28% in 22-23. Obviously, these numbers are still too high, but we are proud that there were these improvements, which we certainly know that Project Cowell strategies contributed to. And then another indicator I wanted to highlight is the last one here, improvements in the percentage of school staff reporting that their school provides adequate counseling and support services. Finally, I wanted to mention the California Healthy Kids Survey, which is also sponsored by the California Department of Education and WestEd, administered to students throughout California. And the beauty of this is that it's the same survey throughout California, so we can compare districts to each other or compare counties to each other. You can look at trends over time. So the core module is consistent, and you can download it here. And then we also created a behavior health module, which adds additional questions looking specifically at changes in students' perceptions of their mental health needs, stigma and access to, and barriers to mental health care. So again, I'll just share a few data points from this survey. This again is from cohort 2. And you can see here the reduction in the percentage of students reporting that they would be afraid to get help if they felt sad, stressed, lonely, or depressed. Unfortunately, there wasn't any movement in not knowing what to do, and slight increases in the percentage who reported that they would get help from a doctor or talk to a teacher or another adult at school. Again, this isn't as good as we want it to be, but at least it's heading in the right direction. One more from this. This is actually the one indicator we were most excited about, looking at the percentage of students who reported that they received help from a counselor or therapist when needed in the past year, among those who wanted to talk to somebody when they were in need. So this did increase from 36% to 43%. And sorry, by secondary students, we're talking about grades 7, 9, and 11. So in sum, just want to say Project Cowell obviously successfully trained a lot of individuals throughout these school districts in mental health topics, formed new community partnerships, and established referral systems. Successes included more staff reporting that schools provided adequate counseling, fewer reporting stigma and lack of knowledge as barriers, and fewer students reporting fear as a barrier to receiving help, and more students receiving needed help. So some of the recommendations are obviously adopting this whole school-wide program approach, training, workforce development, partnerships, and then something that I think Jack and Heather might touch on a little bit more is the need for ongoing funding through billing revenue and grants, which is something that California's been working on quite a bit in the past few years. Thank you. Jack, do you want to take it next?
Hi, I'm Jack Bareilles. I'm the Grants and Evaluation Administrator and Director of many other things for the Northern Humboldt Union High School District. We are very far from Sara and Heather down in San Diego and not particularly close to Hilva and Sacramento. In fact, Vancouver, British Columbia and San Diego are the same distance from where I'm standing right now. My high school district has about 1,800 students, grades 9 through 12, 1,000 in one school, 600 in another, 1,220, and then two smaller alternative continuation schools. Sarah, next, please. So component one in Hilva of the three slides or the three segments we had was school climate. And I need it's important to say I'm not a clinician. I'm not a mental health professional. I was an English and history teacher. I've been an administrator and doing other things for 25 years, supporting career technical education, Indian education, mental health, you name it. Oh no, you're fine, Sarah. And anyway, but that whole tier one, what we found in the past, going back 10, 12 years, where I could find funding, which in the United States is a different issue than it is perhaps in Great Britain. But that you get somebody and suddenly everybody sends every kid who has an issue to the counselor. And maybe that student just needed a teacher to listen to him for 4 or 5 minutes. And so that building that climate is important on that tier one. So one of the things we've used, Sara mentioned youth mental health first aid, which is really geared for the adults to realize, oh, I have some agency. I can actually help students here. Sources of Strength is a suicide prevention program, but it's also a student efficacy program that is geared into clubs and small groups and broader activities. And then the idea of teaching expectations for the students, for the teachers, and all of that. This just happens to be one of our schools. Their 5 little point theme that they have for the school, the responsible, inclusive, determined, engaged. If you're familiar with what's called PBIS, it's straight out of that. Next, please. Our kids too takes the Healthy Kids survey, and these are just data that Sara has for us from last spring. Experiencing chronic sadness and hopelessness in the past 12 months, 30%. Seriously considered suicide, 12%. These numbers are not out of line with most of the state. Down here at school, there's a teacher or some other adult who really cares about me, 67%, who listens to me, 74. That power of that adult who connects. And this is going back to that whole school climate for our grown-ups to realize they have the ability to change the trajectory of a child's life by listening to that kid, by making that connection, by just asking an open-ended question, how you doing, or what can I do for you? That's good. And the thing, frankly, that makes me so sad is that, at school, I do things that make a difference. Only 30% of our kids felt that way. And that is frankly, that is, when you feel like you're doing good, it gives you a reason to get out of bed in the morning, and not, it's not social media, it's not money in your bank account. It is that self gratification or whatever that you get from helping others, and it's unlimited. You can always help others. Next, please. Oh, and we do a student risk screening scale. Hilva mentioned that it came out of our work with Calwell. It's called the SRSS, and our teachers do it 3 times a year for all of our students. Externalizing behaviors and internalizing, and that helps guide how we try to determine what supports kids are going to get. We're not perfect at it. It's hard, but we are trying. Next, please. Now, where we are over a number of years building up to it, a lot of our tier 2 supports, which are on campus, mainly provided by school staff, though we do have partnerships with some of our local tribes who will come and provide specific services to American Indian kids, children who are in the foster or homeless system through the state, and things of that nature. But the idea, this is not therapy in the sense that I'm going to go to a therapist and have an indeterminate amount of time of services and supports. They are more limited duration, can be an individual kid or some of the groups, these empowerment groups. And one of the things that we've done through various programs, and Sara has done the data on it, is students with these like-minded groups of students. Could be left-handed kids with freckles. It could be LGBTQ plus kids. It could be boys groups. If you're working with younger students, could be squirrely grade 5 boys who just need to be reminded how we behave around other children and things like that. Whatever it is. We have existing groups as well. Our Native American Club. We have career technical education. I'm a huge believer in protective factors and how we can connect students to that. Anything you can do in your school and your system to connect kids. We have a cross-country coach who's been coaching since I was in high school. I'm 58 years old, and James was already there. If I could get every at-risk student in my school on that cross-country team, my Lord, our data would be the best data on the planet. And so however you can get kids connected, it doesn't have to be mental health. It has to be, though, but something where they belong thing. And then again, just the limited duration counseling, individualized. Typically, we go 6 to 8 to 10 sessions where we think, okay, now we need to move this child, help connect this child with somebody else who can provide them more ongoing supports. And next, please. My county, which is 4,000 square miles, it's a pretty big place, has 17,000 students, 31 school districts. Mine is the second largest with 1,800. The smallest 2 county districts in the county have less than 10 kids. These are one-room schoolhouses almost out in the mountains. We all have our own elected boards. We are all independent. It is incredibly balkanized. Our county office of education does their best. Heather coming up next is going to talk about San Diego County, a similarly segmented place, but with many, many more times the students and people. We do have the County Office of Education, the student mental health team who supports us when we connect with them. We need to special education program. It spans our county and the next county. Humboldt County Children's Behavioral Health, Foster Youth Protective Services, the Tribal Mental Health, which is a matter of knowing which one, because a student might be a member of the Big Lagoon Rancheria, and the services they get there, the Yurok tribe will say, that's great, but that's not our kid. So you have to really learn to air traffic control who might be the appropriate person. And then other nonprofits and agencies, it runs the gamut. Next, please. Building community partnerships, this component three is what we're really kind of talking about. And this earlier, I think Hilva talked about the idea of training grad students. We're fortunate we have a university in our community where students are becoming school psychologists and school social workers. And in their second years of both of those programs, they need to do anywhere from 400 up to 1,000 hours of time connected with, under the supervision and guidance of somebody in one of those positions. And that is a great way to bring a multiplier into your school to be able to provide students those skills. It's also so important in the long run, whether that school social worker or social worker becomes a school social worker, or she or he works with the county or another agency. For them to understand schools and what schools can provide, it's going to allow them to be so much more impactful in their practice. And even realizing something like, oh, yeah, there's 31 school districts in this county. Just because I spoke to Jack at Northern Humboldt doesn't mean that Molly in Southern Humboldt, 60 miles away, knows the first thing about what we're talking about. And so that awareness is so critical to knit that net, to build that network of connections in your head. And for younger, newer folks, helping them support and develop, supporting them and help them develop that is just critically important. Some of the things that we've done going back to even before Calwell was some state-funded initiatives that has helped us to develop those connections. Humboldt Bridges was the first one with our county of Humboldt, with mental health funds. It supported mental health supports in the school with clinicians, but also non-clinical staff to support children and families. Then Calwell, we received a federal school climate transformation grant. That slide earlier, the Pride one. We weren't doing that 6, 7 years ago. Our high school principals, my friends, thought it was, oh, it's too babyish. It's something that you do in an elementary school, not realizing that high school students respond well when we tell them, here's what we expect you to do, and we reinforce that. Lo and behold, they do that a lot of the time. And then some of these mental health training grants, which we've been very successful with. Unfortunately, they're currently on the chopping block with our administration, but we will see what happens on that. But they've all been, this is all coming out of this connections. It's funny. You can't drop this all into Chat GPT. You can get a lovely narrative put out of there, but it's that time connecting. And that's really the important thing. There are people, and you know who they are, who seem to know everybody or seem to be able to pick up the phone and talk to somebody else, which actually leads us to my next slide, Sarah, which I was not going to use. I did this. Oh, no, there we go. One more slide. You can't get the access to school health services without those community partnerships. No school, very rarely is a school so resourced that they have everything they need in on site. And even then, you're going to have a child who's going to need a therapist. You're going to have a child who's going to need a psychiatrist, mental health services. We will always have something beyond our scope. But the more we can work and more we can connect, and even if it's guidance from an expert, say, well, have you tried this? Have you tried that? If nothing else, it takes the load off of me as the person saying, oh, yeah, we're doing what we're supposed to be doing. And if we've done our best, it goes beyond it. Okay, Sarah, go to the next slide. There we go. So I did this back in January of this year, and Sarah said, she thought it was so funny, so I put it back in again. But yeah, with young staff, I always say, quit emailing for the love of God. Pick up the phone, call these people, because once you've become friends with them, it will happen. And I'll give you a sad but real example that happened some years ago. We had a child tragic. Every child's death is a tragedy. This child committed suicide. And I didn't know about it. It happened overnight. And I got a call from the head of Humboldt County Children's Behavioral Health at about 7 in the morning saying, Jack, what can we do? I didn't even know what had gone on. But literally, this person calls me at 7 in the morning, felt comfortable calling me at 7 in the morning to ask, what can we do? It had not been that way 5 years before. We didn't even really talk to each other. And so, God bless them. They sent in clinicians, they sent in mental health people to help us and our kids and our families with the grief that we were dealing with. But it's a sad story, but it also shows the power of that connection. And so, for crying out loud, spend time with them. And if you're a school leader, put your people together with their colleagues from these other things. Talk to your person at your level and bring them together so that they're not sitting there. Because as I like to say, when selfish motivations align, things do get done. And that selfish motivation, if you're Hilva Chan, is to help kids. If you're Heather in San Diego, if you're Peter in England, it is, we want to help students. We want to help kids live happy and fulfilling lives and be productive members and happy members of society. So it's not a bad thing. It's like how there are people out there who want to help particular groups of kids. Well, we've got some of those kids in our groups. How do we connect these folks so that they can do what they want to do, that they feel they need, that they're empowered to do, that they're funded to do? That's a win. And so there we go. Next thing, I think that might be all. Oh, what are these? Okay, well, there we go. It takes time and repetition to build connections. One email. I sat in a meeting with them at a power. No, you've got to get their phone number. You've got to become friends. You have to become friends. As I said, you've got to bring the leaders from the different organizations together, because once your staff sees you talking and realizing that you like each other, then they feel released and empowered to do it. And just like anything else, if you're training students to kick a soccer ball, as we would say here on this side of the Atlantic, you have to practice it. You have to learn how to do it. And again, without those tier one universal supports, everything becomes a tier two or a tier three problem. You have to teach those expectations. And the watch outs, people come and go. If everything's based on one person and that person gets a promotion or that person retires, that person wins the lottery, you really need to build a broader network as they come in, so that that inevitable change, when it happens, you've got that momentum going, and the same idea, multiple connections, the more you can do that. I think that's it. Sarah, check the next one, please. Yeah, there we go.
Okay, I'm up, I guess. All right. Hello, everyone. Heather Nemour here with San Diego County Office of Education. And we are a county with 43 school districts, 129 charter schools, over 500,000 students, and over 700 schools. So that gives you a sense of how large we are, and we are a border community. We are located at the U.S.-Mexico border, so have many districts that are actually border communities as well. So with that, I'm going to talk about us being a part of Project Cowell, and I can't remember, Hilva, if we were the first cohort. We were, okay, first cohort, Project Cowell. And we were able to do this 5-year initiative that really built an incredible infrastructure and foundation for us to just grow and expand our work with mental health in schools. So with that, thank you for the next slide. All right. So with that, with Cowell, when I came on board in 2016, there was just a team of 2 at our county office of education, and we were able to really build a whole unit within our department dedicated to mental health, suicide prevention, and positive school climate. And now we are a team of about 8, just growing from this initial project. All of our initiatives and grants, we have a little bit of a unique focus in our county where we focus on capacity building. And, our belief is no school will ever have enough mental health clinicians or mental health providers. But when we can build the capacity of our schools and our school districts to become champions and ambassadors of mental health and suicide prevention, we have really changed systems. And that's what we want to do with capacity building. And so with Project Cowell ending, we were able to be a part of some other very large grant initiatives. And our large one we're in our last year of our 4-year grant is called Creating COPES, which is creating opportunities for preventing and eliminating suicide. And so we really have been able to take so much of that capacity building work and even the funding from Project Cowell to leverage and build our capacity and build our initiatives. And we are now supporting in this grant over the past 4 years 15 school districts, 16 charters, which equates to over 440 schools that we are doing a lot of this work in. And we're really created a model, being in the fourth year, to replicate the model. So presenting at conferences, look at everything we're doing, but also here's everything you can take and replicate. So I'm going to just highlight some of the high level pieces that we're doing. And if you can go to the next slide, please. Okay, so with component one, school climate, what's been really important is for us, like Jack, we are really saturated, our county, in youth mental health first aid. And it started in Project Caldwell, became trained trainers at county office, trained trainers in some of our school districts. And now with this larger initiative, we have really just because it's a part of what we do. Every month there are youth mental health first aid trainings. We'll go out to a school district if they have at least 30 staff that they want to certify and train. What's so powerful about this evidence-based training is that it's for anyone in a school setting. And it shouldn't just be the job of school counselors or social workers to be able to support and intervene with a student's mental health. It should be everybody, right? So when we can train everyone in a school setting, build their mental health literacy, increase their noticing skills, and at their comfort level, and depending on their role in the school, they're able to notice, approach a youth, and connect them. It's pretty powerful. So we have districts that have trained all their staff in youth mental health first aid, and you consistently see the California Healthy Kids data going in the right direction. So that's a big piece. We don't just do youth mental health first aid. We do a lot of trainings around suicide prevention, intervention, and postvention, and a lot around just the trending mental health issues in our county, whether it's anxiety or eating disorders, but we really keep our districts and charter schools abreast of current best practices and evidence-based practices. Peer-to-peer programming. I was so glad to hear Jack mention sources of strength because we are huge supporters of that. So we have 4 different peer-to-peer programming in our about 131 of our schools. And it's really where our students get trained and they become the champions and ambassadors of suicide prevention and mental health. And what our youth consistently say is that adults are great, but sometimes they just want to fix us. I prefer to get support from my friends, from my peers. And this all kind of came from COVID and just when we were in lockdown and all the kind of collective trauma our kids were experiencing, they were reaching out to each other. And so from then we really, created a teen guide we co-create it with youth every year. So youth have at their fingertips the hotlines, the warm lines, the apps, everything they can do to connect each other and support each other. So peer-to-peer programming is a big one in our county. Sources of Strength, Hope Squad, Bring Change to Mind, and NAMI on Campus are 4 programs that we have. The other thing we've really lifted up to really impact school climate is we created calming corners for 440 schools where they all had to create a common space in their school where all students can go and kind of check in, tap into calming activities, practice self-regulation, self-management skills, kind of decompress, reset, and go back to class. And we provided training and resources to make sure these calming corners were set up in our schools in a way that really supported all students. And so that has been a big piece of our school climate that was lifted up. Next slide, please. And then we have just our suicide prevention work has really been the focus of the last 4 years. Unfortunately, we have lost 39 school-age students to suicide in the last 4 years, and one life is too many. And suicide ideation is really something that's impacting all of our youth in our nation. And so one thing we have done is been able to really create systemic changes in the schools and the districts to where we had them all adapt a evidence-based suicide risk screening tool. And we found before, kind of during Project Caldwell, that everyone had a different tool. Some didn't have tools. Some created their own tools. Some were using a threat assessment for suicide risk screening. And we're talking about life and death here. So Our dream was to get all our schools using the same tool, measuring suicide severity the same way, and most of our cross-system partners that work in schools were also using this evidence-based screening tool. So huge accomplishment that all 440 schools are now using the Columbia Severity Rating Scale, and they all have been trained on it, and not just suicide risk screening, but the continuum of care thereafter, creating a safety plan, providing support to the parents on how to keep their child safe in the home. Relationship mapping. Jack was talking about the importance of relationships. It's everything. So how can we relationship map for our students to make sure they have caring adults and peers in all of the community settings that they're in? And so we have a whole policy to practice suicide intervention toolkit that all 440 schools have really implemented to fidelity, which really means that they have these systems in place that are consistent across all schools. And then the big thing we did is we decided to track the number of suicide risk screenings that are happening in our elementary, middle, and high schools. And what we know through this is that we have high-level trends with over 10,000 screenings so far to know that suicide risk screenings are occurring more in 5th grade than in 9th grade, that suicide ideation is happening just as much in elementary schools as middle and high. So we're looking at those high-level trends in our county and using it for policies, legislation, training, funding, and all of that. You can see here, I just gave an example of one of our chicks data. Students who say they seriously consider suicide in the past 30 days. So you can see over the past 3 years that 7th grade has gone down by 3%, 9th and 11th has gone down by 5%. So we know where our work is, it's working, we're moving in the right direction, and we'll continue to monitor this data closely. But what's important to know is that we are doing this also to model to our state that this should be a part of legislation, that, we collect data from our schools on weapons, the number of suspensions and expulsions, but we don't collect this life and death data that's so critical to our work and our planning and our policies. So more to come on that, but that's something that's been a big game changer in our county. All right, the next slide just shows you when we think about community partnerships and cross-system collaboration. One thing we have done is, and kind of reiterating what Jack said, really invested in creating and nurturing relationships with all of our partners in our county and across our state. So one thing we've done with this big initiative is we've done resource mapping in schools. So every year they do a comprehensive needs assessment. And we ask, one of the many things we ask is, what are your mental health tiered supports for all the trending mental health issues we see with our youth today? Anxiety, depression, eating disorders, bullying, suicide ideation, and so forth. And we have been able to create a countywide map of all the resources in those tiered supports that are available to all schools in our county. We purposely didn't geographically identify resources because we want to be able to support all schools in our county. So once we have that needs assessment data, we see the gap analysis and we can see, oh, this district doesn't have any tier 2 eating disorder resources, or this district doesn't have any tier 1 substance use disorder. So we're able to take our countywide map and fill the gaps, and we create a customized resource map for that district where we continue to meet with them to kind of evaluate the impact it's had on their schools and district, and then kind of just follow up and make sure that those resources are working for those schools. So this is something we're going to take to scale in our county and offer it to all schools and put it on our website very soon. And then that's just an example of, capacity building and how large the scale we take it. So I want to share with you an incredible project that happened out of building a very close relationship with our county behavioral health department ever since Calwell, many years. So the mobile crisis response team has been available in our county for several years now, but it has not been available to K-12 schools. So when there's an incident where there's a mental health crisis, they have a team of non-law enforcement clinicians and peer support specialists that go out to the school now, and they're able to de-escalate a mental health crisis on a school campus, whether it's a staff crisis or a student crisis. And they're able to meet with the student, bring in the parents if it's appropriate, and work with the school lead, and they will do an assessment, and then there is care coordination. So if it's determined, and most of these are for students that are actively suicidal, and they will come and de-escalate. And if they need to be transported to crisis care, they do that. And then they follow up 30 days after to make sure that the resources and everything have worked out. This has been a game changer in our county because many of our schools, they don't have mental health clinicians. And you can do a suicide risk screening. Anyone can do that. That's trained. But for a suicide risk assessment, you really need a mental health clinician to do that. So it's really helped fill that niche. And it's also helped to not criminalize mental health. We have our 911 and our PERT teams that typically go out. And what was happening is students who are experiencing suicidation are handcuffed and taken away in front of students. So what are we doing with, with really increasing stigma? And it was just so impactful in our county hearing the stories from our schools of what was happening, that this partnership has now resulted in a trauma-informed approach to suicide intervention, which has really been a game changer in our county. So that's just an example of, what can come out of really a transformative relationship with these other cross-sector partners that we have. All right, next slide, please. So what are our learnings? And with all our initiatives that we have had, we ensure that the districts and charters create a leadership team because, and Jack mentioned this, there's turnover, there's leadership transition. It should not fall on one person. When you can have a whole leadership team working on this and being a part of it, it is more sustainable and effective. And, capacity building is sustainability. So, we're in the last year of this 4-year grant, we're giving our districts and charters some funding each year to kind of help support the extra staffing work that might come out of this initiative. But we have made sure to build in sustainability beyond this. So we know beyond this grant, the suicide intervention and prevention and postvention work will continue because there are suicide prevention subject matter experts in every school and charter school now that we don't need to go and put on our capes and come save them. They have the skills and the resources and the protocols and practices to do that work. We know I really didn't get a chance to talk about our work around staff wellness because we know if staff aren't well, they can't support students to be well. So we've done a lot of work around that. Just a quick example, we are going to mirror the Calming Corners project, and we are now building calming spaces for staff in those 440 schools because we've heard loud and clear they're burnt out, they need support, their mental health isn't well. And it's not going to change everything, but it sends a strong message to staff that we care about you, and we're giving them massagers and posters to color and all these things to be able to just decompress, tap out and tap back into the classroom. And then we know working strongly through legislation and supporting our districts to meet the requirements of Ed Code and so forth, we know that even though they have policies in place, it typically doesn't impact the day-to-day practices in schools. So our work is really about that. How do we take policies and put them into practice to ensure that students are well, safe, and supported? And that, has really been one of our biggest lessons learned. So with that, thank you for having me.
So thank you, Heather. Thank you, Jack. I think you can now pick up some tips about because I think each school have different capacity. So you hear from like San Diego, which is a large county with many different school districts and schools with different granting opportunities. It's very different from Jack in Northern Humboldt County, right? But I think hopefully you can just pick up some information that you can use and apply back to your school whenever you are in England or in the UK. So this is a brief that really summarizes Jack's journey with us in the past 5 years. So you can just click on it and just get some information about how they really leverage Caldwell resources to build a sustainable mental health infrastructure in a tiered MTSS way. So this one, and then the next one is really summarizing our prior work with San Diego County Office of Education during the first cohort about some of the resources and lessons learned back in cohort 1. And then the next slide, we work with UCSF, Sara's team, to really put out different briefs, trying to really capture and summarize our experience learned with the districts. So if you click on these both links, you can just see our journey back in cohort 1. And in cohort 2, you'll see multiple examples of how different of our partners, good districts, leverage Caldwell resources to really build their own system to really meet their own unique needs. And then our final slide is a family guide we put together, which is a family guide to really help families supporting young people's mental health. We have this available in English, in Spanish, and Chinese. We also put out a one-page flyer where folks can actually print the flyer and distribute at different events, and where families can actually, if they want to, screen and then screen the QR code and get a copy of the digital copy on the phone or on the computer. So with that, I'm just want to thank everyone for joining us and turn it back to Peter. Thank you for having us.
Hilva, Sara, Jack, Heather, thank you so much for taking us through those different steps. And thank you also for your candor in terms of sharing your insights into what you've learned and what you think the key watchouts are. I think that's going to be incredibly helpful for people in terms of developing their thinking. So thank you very much, and thank you for sharing the resources, and thank you for sharing your contact details. And I'm sure that once people have looked at the presentations today and looked at some of the resources, there may well be things that people want to follow up, and I know that you're happy to do that. So thank you very much indeed.